Welcome back to Atlantic Fellows Conversations from the Climate Action Convening in Bogotá, Colombia. I'm Fanula Sweeney. In this podcast, we hear from Atlantic Fellows MAFOKO PHOMANE from South Africa and Nancy Rumaldo from Peru as they discuss the relationship between climate and health. MAFOKO works in environmental health and Nancy is a nutritionist.
My name is MAFOKO PHOMANE. I am based in South Africa. I'm from the Atlantic Fellows for Health Equity South Africa. I work in the area of environmental health, specifically climate and health. I work with communities that are impacted by air pollution. So my work involves getting health professionals to support community struggles. I'm here with Nancy, who is from Atlantic Fellows for Health Equity Global.
Hi everyone, I am from Peru. I live in Lima. I am a nutritionist and my passion is to work with topics like maternal and child and mental health and to work with community health workers too because I think that they are a strong population. And well, we are in Bogotá in this moment. I'm with very inspiring people for different programs and cohorts and it's an amazing experience.
So today we were in Alto Fucho, a community in Bogotá up in the mountains that's working to protect the biodiversity there, specifically the river as well as the forests. We were able to interact with some community members there, a lady that has a herbal garden, a beautiful herbal garden that has amazing herbs, spices, and she is able to make essential oils out of the herbs. Some of us were able to purchase the herbs and soap. Most of the oils are healing for different ailments, and it was really a beautiful experience breathing the fresh air, being in the trees, but also realizing how much the community has to do to defend biodiversity and to ensure that their habitat is not infiltrated by so-called development.
I really was very impressioned to see how is the power of one community when work together like a team. Because today, the leader of this community mentioned that they had to fight with the other business, with the other enterprises, because they want to destroy all the environment closer to your house. They fighting like a neighborhood and they win, and now they have a beautiful school for children and they live in a beauty space every day, training more people in that community about how we can do better our climate change. And for me that is very helpful. And other thing that was important is that exists many coincidences with the rural area in Peru. Peru and Colombia is so close, only 3 hours for flight. It's very same the reality that we have with them, especially in the highlands of Peru, in Cusco. We have the same tree, the eucalyptus tree, to protect the environment and to create a good space for the community. And this is very helpful to me because if Colombia do that, I think that in Peru we can introduce this method to adapt and to create more experience favor to the climate change.
So Nancy and I met in South Africa last year around this time. It was an Africa Brain Health Network convening, so we were talking about issues related to mental health, mostly around using indigenous or cultural approaches to healing and mental health. And today we had a discussion about how, as health equity fellows, we can come together to form a community of practice for climate and health. We were talking about different interventions related to mainstreaming climate and health, primary health care, training community health workers. Normally, their focus is maternal and child health, HIV and TB, but we realized that climate and its impact on health is an area that community health workers need to be trained on.
Yes, totally agree with MAFOKO. When I had the privilege to meet her in South Africa. I was the leader of one project that worked with community health workers and introduced new topics like mental health in the caregivers and about early childhood development. But since this year, I have a new position in my organization. My new topic is about advocacy and community relations. It's focused in the community health workers. And I have now the privilege to see the activities of these community health workers not only in one topic, like maternal and child before. I can see all this role in tuberculosis, in communicable disease, and this is a good experience for me. I totally agree with Mafoko that usually the community health worker is focused in the maternal and child health topics. But I think that community health worker really have a strong role in the community because it's that connection with the health centers, with the primary health. And we need to train in new topics like maybe climate change to obtain better results and introduce a new actor in this topic.
That's right, Nancy. We're really excited about finding ways of collaborating around this area. We also want to work around air pollution and the health sector's role in being able to diagnose, treat. But also, we are of the view that health professionals need to be part of the larger discourse on climate change and the just transition. They need to be part of the political conversations, which often they shy away from. So we're hoping that the Atlantic Fellows focusing on climate and health are going to move forward to build a movement of health professionals that are focusing on climate change and health, but also the just transition.
Well, I think that this experience in Bogotá was very good, not only for the people that I had the opportunity to meet in this country and to reconnect with. I think that is a good space to connect with new problems and to create new solutions about that and involve more of the community and actors in the local government and in other spaces that take decision and can be a big support for all this new process for us.
Great, Nancy. I think it's really been an amazing week here in Bogotá. Today was really the highlight for me, meeting community people that are active, but also eating the food that they've produced and just being in community. We actually got to go down to the river and actually step in the river, and it was a therapeutic, very cathartic experience surrounded by the beautiful mountains.
That brings us to the end of this podcast. Thank you for listening. Next time we hear from Atlantic Fellow Busi Delamini from South Africa about the challenges of bringing about systems change without reproducing the inequities of the past and how climate action is central to working for equity for all. I'm Fionnuala Sweeney, and you've been listening to Atlantic Fellows Conversations from the Climate Action Convening in Colombia. If you enjoyed this episode, please share it on and subscribe to the series wherever you get your podcasts. If you'd like to learn more about Atlantic Fellows and their work for equity, please go to our website at www.atlanticfellows.org.